Greetings, ladies and gentlemen. Today, I would like to introduce my very good friend Felix. I often say that wherever you go and whatever you do, the most important thing in life are the people you meet. As a student at Nagasaki University, the most exciting thing for me continues to be my classmates, many of whom have firsthand experience working in the field of global health. So today, we have a very special guest who's going to be able to talk to us about his experience with global health and about himself and about his home country and about how we came to meet in some ways. So without further ado, I'd like to introduce Felix. Felix, um, let's go ahead and get started. If you could tell us who you are.
Right. So, as James said, my name is Felix from Ghana. I've been working with the Ghana Health Service for probably about 11 years now, before coming to Japan to do masters in public health. So, basically, that's about me. And my background is public health, health informatics specifically.
And can you
Yeah.
tell us where in Ghana you're from? What region?
Yeah, I'm from the Upper West region. That's the northern part of Ghana and the western north part of Ghana. Yeah.
Okay. And can you tell us about how you or what your role was with regards to using health informatics in Ghana? What's that like? What does that mean?
Yes. Health informatics in Ghana is basically I work at the district health directorate. So we are in charge of monitoring and training health staff on data management. Record staff, we train them on how to document that the hospital level. We train the staff on how to record data, the ICT code, and also we train them on how to enter data into the district health information management system. It's a software. So we as a technical people at the district level, our major responsibility is training and monitoring the performance of the various staff at the district and at the facility level. So,
Okay, that sounds very interesting. And how did you come to study in Japan?
yeah, I came to Japan to study through the JICA Ghana scholarship arrangement that is called JDS. JDS is a Japan Development Service Scholarship. That's the meaning of JDS. So it is an arrangement between the government of Ghana and the government of Japan to train the public health managers or middle level managers to become leaders in the future in Ghana with the principles or the ideas in Japan, how Japan developed. So that is the idea between the arrangement between Ghana and then Japan. So to train some staff or some people from Ghana who would eventually become leaders in Ghana and then implement the idea from Japan to develop in Ghana. So that is the scholarship in which I came to study in Japan.
Okay,
So,
and
all right.
please continue. Please continue.
Okay, so maybe it might interest you to know the arrangement, how the scholarship process is gone through.
Definitely.
Okay. Normally, the scholarship opens or advertise every year around November. So whoever qualifies, at least you might have worked with the Ghana service for at least 3 years. Yeah. So you are qualified to apply. Then you apply with a topic. They'll give you you have to suggest a topic that you want to work on. Maybe that's a research topic you want to work on. Then you write a proposal on a topic and submit. They'll invite you for a mathematics exam. Then if you are qualified, pass through that stage, you'll be registered to write the ILS. And then you go through interview. First interview is a technical interview between the candidates and then the professors in Nagasaki University or professors in any of the universities in Japan. Yeah, so if you qualified, then you'll be invited to attend the final interview. Yes, so the final interview will be selected, then they will select the final 2 people actually needed for the scholarship. So that was how I went through it. Thank you.
Thank you. Can you tell me from beginning to end? Let's try to roughly put some dates in this. When did this process start for you? So the application process or your deciding to apply process, around when did that begin?
That was November 2020. Yeah,
Okay. And
November 2020.
when did you receive selection?
I received selection in March 2021.
And when did you arrive in Nagasaki?
I arrived in Nagasaki and actually I arrived in Japan on the 17th of October. But because of the COVID and quarantine issues, I have to be quarantined in Tokyo for 2 weeks. So I actually arrived in Nagasaki in 1st November 2021.
Okay, this was not something I planned exactly, but I think this is actually a very interesting thing to discuss that you just mentioned. This is
Okay,
your experience is very unique, and I think that's what makes this an interesting interview. Can you
right.
describe what the quarantine was like for you when you were in Tokyo, or how that unfolded for you?
Wow. Well, it wasn't easy, but since and the outbreak of the pandemic, it has become normal that wherever you go at the time of the peak of the pandemic, you need to do 2 weeks quarantine. So my mind was already conditioned for it that I have to do quarantine in Tokyo for 2 weeks. So my mind was prepared for it, but it's along the line, it was not easy for me because I just got to Japan and within the 2 weeks, I'm inside the in the hotel. I'm not allowed to go out throughout the whole 2 weeks, only eat and sleep, and then eat and sleep. And another challenge at the time was we're attending classes online at the time. So we just stay inside the indoors throughout and then attend classes throughout the day. Then in the night, you sleep. So basically, it wasn't an easy experience for me, but I thank God, I went through it and it was good.
What did you do during that time to keep from going crazy?
Oh, since I did not have anywhere to go, just in the hotel. Then they will bring you food to eat and attend classes. So basically, one of the things that engaged me was the online classes. Yeah, it engaged me. So sometimes, like, you attend classes throughout the whole day. And then in the night, it was so boring. So I have to call home. So normally in the night, I engage my family back at home. Then we just talk until I feel sleepy, then I sleep. So that was what was keeping me going till the quarantine was over.
And what did you think of the food while you were in quarantine?
Wow, that's another experience because coming from Ghana, I was used to my Ghana foods, for instance, fufu, bangkong, and then the like. But in Tokyo or in Japan, none of those food was served. So basically completely new food. And the only food that was similar to Ghana was the rice.
Mm.
So, but because I did not have choice, I just have to enjoy the food, condition my mind to eat And then, so gradually I got used to the foods. Maybe by the 10th daytime, the food was something that I was beginning to get used to it.
Did you
But
ever develop a favorite food while you were there? Was there a specific food that you actually liked, or like one food that you hated?
um, honestly, I don't know the food, their differences, but there were some I really liked so much. Even though they were strange to me, I like it. And there were some too I didn't actually like. But up to now, I don't know the differences between the food because I don't know their names. Yeah.
Okay. Okay.
Yeah.
And that's a good lead into another question. When you coming from Ghana and coming to Tokyo, or not just Tokyo, but Japan in general, were there any things that gave you kind of culture shock or that you found very different or disorienting or confusing?
Mm. Yes, yeah, exactly. I had about three cultural shock when I arrived in Japan. One of them was the waste separation or trash separation. You know, in Ghana, we have one trash bin that you put every waste into it. But in Japan, they have color bins or different and trash bins. So you need to separate the trash into those separate bins, which was difficult for me to differentiate which one is for what. So, but they gave us some sheet of papers, the color description, and which trash goes into which bin. So initially it wasn't easy to be able to differentiate them. But along the line, as you stay and continue to do that daily, then you get used to which trash goes into which bin. So that was the first cultural shock to me. The second cultural shock to me was eating with the chopsticks.
Right.
Yeah, I have never used chopsticks before. In Ghana, we either use our hands or we use a fork or a spoon. So these are the things that I was used to. But in Japan, because if you don't use the chopsticks, then everybody feels like surprised. Why you alone you are using spoon or you are using fork on everybody using, or you are using your hand. So you don't feel comfortable to do that. So you are forced to use or you are compelled to use the chopsticks by yourself. So it was something that I had to learn, and then it took me time to learn how to use the chopsticks. But so that was the second cultural shock I had. And then I think the last one, which is not really a cultural shock, but I think it's have to do with a developed country, the difference between developed country and developing countries. For me in Ghana, which is a developing country, I mean, you can buy everything outside. We have a lot of street vendors or street foods. You can just buy anything you want on the street. But in Japan, everything, all foods are sold in even company shops where you go to buy foods and those things. You cannot get it outside. And so that was one of the culture shock or the differences I had to experience and got used to in Japan. Yeah.
I see. So at this point, you've been here for close to a year, the better part of a year.
Yeah.
Do you feel like
Yes.
has some of that culture shock gone away, or has any of that changed? Have you developed new culture shock, or because do you feel like you've adjusted? How do you feel about being here after about a year almost?
I think about a year now. I'm okay now because I've experienced all the cultural shock, and I have adapted to to living with them. And
Okay.
then yeah.
And how about adjusting to Nagasaki University? So far it's been Japan in general, but
Yes.
what about your experience at the university?
Yeah, my experience at the university was another experience, difficult at the time because COVID. and arriving late also in Japan. So classes were already ongoing. And then, there are a lot of paperwork as a foreigner you have to go through in registering and then opening bank accounts and so many things to be done at a period. So, and I had lectures to attend as well. So it was challenging for me. But fortunately for me, usually JDS will give you a local supporter for the first 2 weeks that you'll be in Japan or in Nagasaki. I came to Nagasaki. JDS gave me a local supporter to help me out. So the person helped me to look for accommodation, take me through the town hall to be able to register or do all the registration and all those stuff. Then help me to open bank accounts. So I had to manage between attending lectures and then doing all these activities as well. Then coming back to the university itself, I think one good thing about the university arrangement is the tutor foreign students relationship. Normally, you are given one of the Japanese students as your tutor to guide you or to help you to be able to do some of the daily activities. Yeah, and it was a good thing. That was what helped me to adapt.
Okay. Okay. That's very informative. Can you tell me what your area of focus is? What are you studying in Nagasaki, like your research project?
Okay, so actually, the course I'm doing currently is Masters of Public Health, and I'm specializing in international health development. Yes, so my research specifically is on data management. So I want to look at the COVID-19 data in Ghana so far. When COVID came, there were a lot of decisions that have been taken based on the COVID data. So I want to know what is the quality of that data, of the COVID data that have been generated so far. So my research is on the quality of COVID-19 data in Ghana.
I think that's a good time to transition to another area of interest that I think a lot of people who might watch this might be curious about. Can you tell us what COVID was like when it struck Ghana, or what Ghana was like when COVID struck? Because I think everyone around the world remembers when their lives were changed, and everyone in the world seemed to have had their lives changed by COVID. What was the impression people had? When did it first seem to like really change the country? What was the change like? Can you walk us through that, please?
Yes, I think Ghana is not different from the rest of the world, as currently the world is just a global village. So whatever happens any part of the world, it is known and then seen by the rest of the world, everybody. So at the beginning of the COVID, when it started in China, every Ghanaian got to know about it through the media. So everybody was praying and hoping and making preparation. And the perception was COVID was a dangerous disease that is spreading to every part of the world. So Ghana hope was never to record any case. So there was a lot of sensitization and preparation to prevent the COVID from getting to Ghana. But unfortunately, the COVID got to Ghana. I think it was an imported case. The first case was okay, let me not be specific, the country that brought it, but it was an imported case. In March 2020, the first case was recorded March 2020 in Ghana. So a whole lot of things changed. And a lot of anxiety had to set in, and people were so skeptical about COVID. But along the line, there were a lot of preparations that went on to preventing COVID. So the face masks wearing was something that was preached, or was people were educated on to wear face masks, and also hand washing and sanitizing their hands was something that was also encouraged by everybody. So people were ready and practicing it. But along the line, something happened, and people that broke the tracks of people about the COVID, the whole COVID and its management and its process. A lot of perceptions came in, a lot of rumors came in that it actually COVID was not a disease, but people felt it's like it's a way of government trying to control the people because of the behavior of government officials themselves at the time. They said everybody should wear face masks. They at a point even they implemented a lockdown in part of Ghana, and then they banned mass gathering, church services, mosques, and those things. So the people expectation was that, so since they banned all those things, and so the politicians or the government officials themselves should also practice it. But it was in the contrary. When government officials or appointees are gathering political, it's also coincided with the election time in Ghana. So there were mass campaigns and they were seen not wearing masks, and a lot of gathering of politicians and those things. A great crowd, no face mask. So that actually broke the trust of the people. So the people said or think that these people are deceiving us. Why is it that they are not wearing masks? They don't care about the protocol of COVID, but they are insisting that we should wear masks, we should not gather. So the people took it that no, this is not true. And they begin to question this COVID. Is it really even true? Where are the cases? Who actually had COVID? They wanted to know the real people who had COVID so that they can testify that this person had COVID. But they just saw it on social media. They saw it on TV that people have, this number of people are having COVID. This is what is going on, but nobody saw the cases. Nobody saw the real patients of COVID. So people began to not wear masks and begin to live their life. Yeah. So in short, this is what I can say about the beginning of COVID in Ghana.
So that was the beginning. In our classes, I'm not sure. I'm sure this came up, but maybe we weren't in the same class at the same time. But this was a discussion, was the issue globally with vaccine inequality. So some countries have more, some countries have less. But part of that conversation often includes how many people are accepting the vaccine, where vaccines are available. In the case
Yeah.
of Ghana, how much vaccine was available and how popular was taking the vaccine?
Okay. So that's another challenge, as a developing country or not a poor country, let me put it that way. Vaccine acquisition was another challenge. Differently, the rich country will go for the vaccine. You don't have even the money to purchase it. So even if you have the money, you don't have the influence to be able to get the vaccine. So it was difficult for Ghana to even purchase, to raise funds to buy the vaccine. So what happened was the COVAX arrangement. Yeah, Ghana got its first vaccine from the COVAX arrangement. So I think Ghana was one of the first, either the first or the second, to get the vaccine from the COVAX arrangement. So what happened was that when they obtained the first vaccine, they have to vaccinate the prominent people in Ghana first. For instance, the president, the ministers, the prominent pastors and all those prominent social media TV personalities. So this was to instill the trust in the people that the vaccine is good and that it works, just to let people be able to accept the vaccine. Because when the vaccine was coming, people had another perception about the vaccine that no, this is not true. This is not a good vaccine. Probably they have an agenda for this vaccine, maybe. And one of the perception was that they wanted people to be vaccinated so that they cannot give birth. Yeah. And then also in the future, this vaccine may have some effect in their lives. So people were skeptical about it and they didn't want to even take the vaccine. So they have to use this strategy to be able to gain the trust of the people that the vaccine is good. Yeah.
That's an interesting trend. So can you tell us what vaccines are available in Ghana typically?
Yes. The first vaccine that came to Ghana was the um AstraZeneca. Yeah, I think AstraZeneca was the first. Then before Pfizer came. So basically, now there are 3 or so vaccines that is being used in Ghana: AstraZeneca, the Pfizer, and then the Putin also. I'm not sure, but Putin too is available. So after they finish with this, those prominent people, the next stage of people to be vaccinated were the health staff. Yeah. So I received my first vaccine in March 2020. And then because of the shortage of the vaccine, I couldn't get the second dose early. So I had to receive the second dose in September 2020. Well, no, March 2020.
Right.
Sorry. March 2021. Then the second dose was received in September 2021, just before I came to Japan.
And it's interesting we're talking about infectious disease right now. Ghana made the news not long ago. There were new infectious diseases that were recently detected. Are you aware of those, or can you talk about those at all?
Yeah, so I think currently there are 2 infectious diseases that are ongoing globally. Let me say globally. That includes Ghana. That's a Marburg virus and then the monkeypox. So monkeypox, actually, I am not aware of. There are a lot of suspected cases in Ghana, but there had not been any confirmed case of monkeypox yet. But Marburg virus has a number of them has been confirmed in Ghana.
That's an interesting one. Do you know the symptoms or any statistics with regards to that virus?
Yes, Marburg virus. Actually, I've not read a lot about its symptoms and means of transmission, but I know the statistics. They are about, so far, I think it's about up to 10 cases have been identified in Ghana. So that's all I can say about Marburg because I'm not in Ghana. I don't really follow the news, but what I know is that there is a lot of sensitization ongoing and circular being sent from the Ghana Health Service to most of the institutions about Marburg virus. So maybe the signs and symptoms, how it is transmitted, and how you can protect yourself or prevent it. So those are the circulars that are being circulated currently.
Okay, we have about 5 minutes left. In that time, I'd like to talk to you about your future with public health. So, when do you expect to finish the program, and what do you expect to be doing after you finish?
All right, so I'm expected to graduate September 2023. And then as per the scholarship arrangements, I have to go back to Ghana. And then to implement what I have learned in Japan here. So I think I have about 3 years per the scholarship arrangement with the Ghana service to implement what I've learned in Japan. After that, I can decide to do any other thing. So per my career plan, I wish to advance in my education to be able to implement what you learn. You need to go higher for you to have weight. So let's say if I do my PhD and I'm talking about public health, and I'm talking about global health, and I'm talking about international health protocols, people at every level will listen to me. I can have the weight to be able to implement and to influence policies at various levels. So that is one of my objectives to advance to do PhD.
That sounds very exciting. Where are you?
Yeah.
Is there a place you're considering studying?
Actually, since it's expensive, but I wish to do it outside Ghana, not in Ghana. So maybe in Australia, in the US, in Canada, or in Japan. Any of these countries, if I get a scholarship, if I get an opportunity to do a PhD in any of these countries, I'll gladly take it up. Yeah.
Excellent.
Yeah.
Okay, that's a lot of very exciting information to get from you. As we're wrapping up,
Okay.
I want to ask you just a couple of very quick, simple questions. We practiced this a little bit before last week. Can you remind me? You speak several languages. What are those languages again?
Okay. Actually, most of the languages I speak are local languages. Apart from English, in Ghana, we have over 47 languages that are spoken and written. So I can speak my own dialect, which is Dagari. In Ghana, I can also speak Twi. Twi is one of the major language in Ghana. So almost every part of Ghana, they speak Twi. Yeah. So I can speak Twi as well. And then maybe a little of Frafra, which is also a language in the northeastern part of Ghana. Yeah, so
Okay.
these are the languages I can speak.
Okay, so that's quite a few. As an American, while this I shouldn't say this is true for all Americans, a lot of us have not really mastered speaking other languages besides English. So I
Yeah,
always admire when I hear people who are able to do so many different languages. And something that seems kind of interesting when I meet a lot of Africans is it seems like people from different, especially I guess from West Africa, it seems like there's a tendency that everyone has maybe one, two, three different languages that they can speak in addition
yeah,
to the national language.
yeah, yeah.
Okay,
Unfortunately, French, we are surrounded by French speaking countries, Togo, Burkina, and Cote d'Ivoire. But unfortunately, I can't speak French because just a little. I, I did not learn French in school. So,
I see. Okay, well, ladies and gentlemen, thank you very much for watching. This was Felix, one of my classmates from Ghana. And Felix, I'd like to say thanks again for your participation.
right. Thank you very much for having me.